So our guest speakers tonight are from CASH, which is the Canada-Africa Community Health Alliance. The slides that you have seen circulating are from the recent mission that Keith and I went on with the Agnes Valley Boys and Girls Club. Most of you, or some of you will remember Jimmy Sebulime, who was here in February, and it was Jimmy's talk and Paul Jay's talk that got me interested. And our club graciously agreed to donate $2,000 to CASH and to the Boys and Girls Club to further the mission. So we've invited them back to give us a talk. It's I won't steal too much of their thunder, but one of the nice things about CASH is that it's a small Ottawa-based NGO, and it's very easy to see the impact that it has in the various communities that they go into. So you can, that was certainly one of the things we found in Kamengo, was to see that direct response. So we're excited to have them back to talk about the changes that have happened in CASHA and where they're planning to go for the future. So I'll turn it over to Lise.
Thank you. Sure. Great. So, thank you so much. Thank you for having us here tonight. I'm Lise Turpin. My claim to fame is the Snowy Owl Ace Foundation and CASHA. The Snowy Owl Ace Foundation is our family foundation. I lost a brother to HIV in 1993, and I met this wonderful man called Dr. Don Kilby, who was my brother's doctor at the time. And when in 2006, we founded the foundation and established it in 1995 in memory of my brother. And in 2006, I started running the foundation full time and decided I would venture to Africa. I had an uncle who'd been a bishop there, or was a bishop there for, well, he was in Africa for 50 years, and so in Uganda. And I always had this interest of going. And so I joined the mission in 2007, one of the medical mission. And am I buzzing this? Or is that me making that noise?
It's batteries.
It's batteries.
Sorry.
No, it's all good. I can probably speak low enough that So in 2007, I joined a mission, and I never looked back. Started going. I thought that CASHA had so much to offer for participants. I think that I got a lot more out of it than some of the people in Africa. But they are a grassroots organization, and I felt that I could see where the money was going. I could see firsthand what was going on. And I loved that it was all volunteer based. And when I got back from that first mission, I joined the board. I started overseeing the orphan program. And as I said, I've never looked back. I've been going there twice a year since. So I was spending close to 5.5 months in Africa, and I was mentioning to some people that this is my first winter back in about 8 years. And so you can thank me for the nice weather. This is the universe giving me a helping hand so that I can, after last year's crazy year. So CASHA is volunteer based, as I mentioned, and it was founded in 2001 by Dr. Don Kilby, who went with a group of volunteers to Gabon, and he arrived there with medical bins, and you know some of the bins of the challenges that he would have had then. And he did have some partners there, because that is CASHA's true claim to fame, is we partner. So it's Canada-Africa Community Health Alliance, and we have a partnership with all of these different organizations in the different countries that we're at. So he arrived there with a team of 13 people, I believe, if they could be fewer, and they went into the jungles. I remember him telling me that his contact, on the way out of the jungle, his contact had already paid for the truck. So they saw the truck leaving, and he ended up having to stop vehicles to get his team back into a place to where the airport was. So, I mean, we've come a long way since then. Our partners are now very, very reliable, and we have wonderful people like Jimmy on the ground in Uganda, and his team there. They're fantastic. I had the opportunity to go on one mission there, and they are an incredible team. So they offer basic health care to isolated African villages, and through medical missions, long-term sustainable health solutions, through targeted health infrastructure development. So we do a lot of work. Your mission was an infrastructure mission, wasn't it? So it really has made a huge difference for all the people in Tanzania, in Africa, sorry. We work, as I mentioned, in partnership, so we increase access to high-quality healthcare services, and part of why I got there was because there was a focus on HIV. Now, you can't go to Tanzania, Uganda, Benin, Africa, anywhere, and just treat HIV. You've got to look at the big picture, and it's a holistic approach, and that's what I really loved about Kasha. It's truly a holistic approach. So we bring medical supplies, provide medication, and we are also there to partner with the medical teams there and trying to bring their standards up a little bit higher so that they have more education and are a little bit more able to help their people. And we provide education for hundreds of children. Jimmy was telling me they have 160 kids that they put through school. There are some kids, and I'll talk about it a little bit later, in Tanzania as well as Benin that we support their programs. They're not so much orphan programs, but they are orphan for much of it has to do with HIV, but a lot of it has to do with the fact that they're vulnerable and they could be at risk of not being able to get to school on their own and so on. And we try to improve the life conditions of isolated African villages by, as I mentioned before, infrastructure, income generating activities. Jimmy's got quite a few of them happening in Kamengo, and there are quite a few different programs. We actually try to use Jimmy's model of the community center in Tanzania, and it's functioning very well now. So I was lucky to have that opportunity to go to Uganda and see firsthand what that was like, and so we fashioned it after the community center in Tanzania, and it's amazing what help that is for the community around. So I just want to give you a little bit of an overview of what Kasha has been like over the last 15 years. So Sub-Saharan Africa is where Kasha is, and Central Africa. So just quickly stats here, I won't read all of that for you, but there's 35 million people in the world that are infected at this time with HIV. 24.7 million are in Sub-Saharan Africa. So 71% of all HIV infections in the world are in Sub-Saharan Africa. And this is part of the reason that Dawn decided to focus on Africa to try and make a difference there. And there are more women living with HIV in Sub-Saharan Africa than HIV positive men now. So it's really, and the women are younger and younger. So 15-year-old women that are being infected, we can't even call them women. So, and the young people, so between the ages of 15 and 24, it's huge. There's 2.9 million children who are HIV positive. But that's really part of why Dawn decided that this is where we needed to go. So Sub-Saharan Africa is where we are. Kasha profile. When we first started in 2001, we had one country, one mission, one partner, and we had a small grant of $75,000. Now, we are in 4 countries, 3. Gabon is sort of on the edge right now, but we've got about 12 missions. Some of them being medical, some of them are infrastructure missions, and so it's a lot different than it is. We have over a dozen partners, and an annual budget now of $1,500,000, and we've got 3.5. That 0.5 person is sometimes me. We've got half a person around there, so it's changed a lot. In 2001, this is how people got around in Gabon, and it's all islands in Gabon. So for many of these people on the islands, they never get any health care, none whatsoever. And so Don came up with a really great plan, and this is what he came up with. So he's got a mobile clinic. Now, there are some issues in Gabon at the moment, and we haven't been holding missions there. The boat is still there, it's being used, but we were using them for missions. The Gabonese are still trying to get us to come back, but the political instability is really, that's one of the wonderful things about Kasha. We will not put anybody in jeopardy, and we care about our people, and it's really not somewhere we want to go at this moment, but this is one of the Kasha's accomplishments, that they've built this boat. This is healthcare in Benin in 2001. And through the help of Kasha. Well, you know, traditional medicine and the witch doctors are really huge, and there's really a lot of faith in them, and that is a bit of a problem. It's a huge issue, actually, because we can't always get people help and get them to see the traditional or our medical teams. But now, in 2013, this is what they have in Benin through the help of Kasha. And some of the money that's been raised, they have the infrastructure mission brought up a nice clinic. And this is actually a medical caravan that Kasha held in Benin. Benin also has an orphan program, and they have 50 children that we support. This would be what the Vulnerable Children Program looked like in 2001. And now, through the help of people like Jimmy, through the help of ourselves, through our orphan programs, the OVC, we call it Orphan and Vulnerable Children. Vulnerable because they could become orphaned. They may have only one parent, or the two parents are ill and could be on their deathbed, so they call them vulnerable. So we now have programs in Tanzania, Benin, and Uganda. So the programs in Tanzania and Benin are our core projects, so those are projects that Kasha does raise the fund for. Jimmy has to raise the funds for kids in Uganda, and I just commend you for everything that you do, Jimmy. I think it's amazing. So this is way different than what they first started with, just having maybe handing out a bit of food is what we were doing when we first started. So, HIV care treatment was a prayer. Rotary Club, thank you Rotary, helped us build this HIV center in Tanzania at the base of Mount Kilimanjaro. And it was through sweat equity as well as funding. And so we were a Rotary Club out of Toronto helped us out, and we Portmore. There you go. Thank you, Jim. And that cow there is that's the lawnmower for that area. That's what they call the lawnmower. But when they first opened up the HIV center, or even talked about it, they said, yeah, we might maybe have 50 patients to come after the end of the year. 2,000 patients is what they have, and they keep coming. And now, because antiretroviral medication is provided in Tanzania, it's provided in Uganda, I believe, as well, and most of the countries in the continent of Africa offer the medication for free. There is a huge, huge, huge improvement in the health of all people. And the issue is more around the stigma, the discrimination that is as bad. Is it me? I'm magnetic. I tell you, it's that universe thing. We can turn it off. I can probably just talk by myself. But in any case, it's the HIV center now that there's at least 2,000 people now. But HIV is, the United Nations, UNAIDS is really trying to make a difference and stepping up. Everybody's stepping up to the plate. So I believe that there's many strategies that are in place now that are going to make a difference. And we're hoping that by 2030, which is what the aim is that 90% of the people who are HIV positive will know it, because right now 25% of the people who are positive don't know it. So you can imagine what that can do. 90% of the people who are HIV positive will have access to care, and 90% of the people will be alive, will be adhering to their medication. So they will be, if you adhere to your medication long enough, then your viral load is undetectable, and it's very, very, very difficult to transmit that virus. So that's what our hopes are. That's HIV Center has made a big, big difference in that area, and that we're trying to bring in some HIV centers in other areas as well. So this is what the need for basic healthcare was like in 2001, and they would line up, there'd be thousands and thousands of people, and we still see it today. Same thing, and personal space is not something that we see a lot of there. So they, had you been on a medical mission, you would see that the one that I attended in 2013, we would have 500 people a day come and to seek treatment and surgeries and so on and so forth. In Tanzania, there's many projects. We have it's our largest, that's where we have most of our projects, is in Tanzania. We have the orphan program, as I mentioned. We have the Children Living with HIV and AIDS program, and that's a program that our foundation supports. It's support for the kids who are living with HIV. We've got medical caravans, of course, in Tarap and Karewe. We have yearly caravans to Shirati, both medical and infrastructure. There's a vocational training school that is amazing. If you ever have a chance to see this this sister, I always tell her that if you weren't a nun, you'd be a millionaire because she's such a brilliant woman and really a great businesswoman. But she is, everything goes back. Everything stays there. PPE is another core project of ours. There's another project. It's another it's power prevention through empowerment. It's mostly geared through women in the Moshi area, so in Tanzania as well. And there's the Boys and Girls Support Program as well there. And there's an infrastructure project where they built a classroom in Karewe, and they are just finished the construction of an OR theater, which is in Arusha, just outside. And this is Sister Clarissa, who was our first partner in Tanzania at the Kilima Hospital. And she has since moved on, and she is now at another center, and we are still supporting her. So we've just built an OR for them, for healthcare. So just this is what struck me when I was in Tanzania. And it was just that there's a sense of community. It's all through Africa. People just take care of their own. They do. They take care of each other. And so an anthropologist proposed a game to these kids in an African tribe, and he put a basket full of fruits near a tree, and told the kids that whoever got there first got to get the fruit. And so all of the kids ran together, and they sat together enjoying their treats. They all went. And when he asked them, why didn't one of you run faster and you could have got all the fruits? And then exactly as he says, Ubuntu. How can one of us be happy if all of us are? It's just a sense of community. That really, it really rang home. My culture shock is always when I come back. I come back to see how much we have, how much we waste. And when I hear, I know, like the color of my countertop, I think, do you have a countertop? You have a floor. But thank gosh for all the people that are here, because we are able to support others that way. So, and so this was a bit of the sense of what I felt when we were there. So our medical missions, we have Canadians that come, and they're Canadian participants. During the medical missions, they offer general medicine, they offer gynecology, they offer ophthalmology, dentists. I've never seen anybody pull teeth like the dentist that is in Uganda. She's amazing, this woman. And she would have lineup, and there was no yelling or screaming. There were just all these people waiting to have their teeth extracted, because that's all that they could do. And in order for the pain to go away, they got their tooth extracted. And what would we do? Oh my gosh. Major surgeries. We have a wonderful surgeon that has been going to Uganda, Mark Hardy, has been an amazing man, and is offering surgeries that are sometimes life-saving, sometimes are just, you can't imagine what some of the people have to live with. I'll never forget, there was one woman in the Kilima area that came to us, and her uterus was hanging down between her knees. And she'd been like that for 5 years, and that's how she lived. She would have it was horrible, and we were able to offer a life-saving, and for them it's called elective. It wouldn't have been elective for any one of us here. It would have been, there's no way we would have got to that point. So we're really, really fortunate to have such amazing volunteers come and help us out and really give of their time and of their heart to help others. So this is a bit of what, our medical missions, people waiting, and that somebody will be taking the opportunity to keep their students in line there. That's what that's about. So I'd like to ask Jimmy to come up and talk about it again. Jimmy and Linda, you should come up.
Yeah, I should come up too, but I want to thank you. You did an amazing job, and I want to thank all of you for having us here. It means a lot. She spoke very well about Cash Up. Cash Up is a unique organization like this. I also met Dr. Don Kilby, and I didn't really believe him, but I was born in Uganda, and I was lucky to move here at age 12, and I thought I had an obligation to Uganda. I just did not know how until I met Dr. Kilby, and he believes in partnerships. So he allowed us to create a Boys and Girls Club. In addition, our project in Uganda does not exist without CASHA. We're under CASHA. We raise our funds through CASHA. It's just CASHA supports us and gives us a medical mission, and I've been the medical mission lead for Uganda for the last 8 years. And when I couldn't go, she went on my behalf and did an amazing job. So I'm also converted. I speak just like her on the importance of a medical mission. I remember my grandmother's concerns were always when we got sick, what am I going to do? And the mission, people line up, they stay there. We were just there recently, and a 5-year-old boy passed away from malaria. And Dr. Peter Newman, who came with us, I think he was really bothered. All of us were shocked. A 5-year-old boy died from malaria in 2015. That is a reality in Uganda. So the Boys and Girls Club is really something that when I came to Canada, I didn't speak English. I did not go to school. So my mother put us in the Boys and Girls Club by Prince of Wales, and that's where I learned to speak English and really become from being a shy boy by making friends there. So I always had a dream to set up a Boys and Girls Club in Uganda. I just did not know how. And when I met Dr. Don Kilby, he's like, present your project to CASHA, we may accept it. And to my shock, he accepted it, but under condition I have to do my own fundraising. So when I met Linda and I came here last time, we spoke to you guys and you gave us $1,500. That goes a long way. We did do the medical mission, so some of the money's still in CASHA, but we didn't have enough people. We turned this mission into an infrastructure/education mission. And Linda could speak to it, and Keith, I think they were great. What we did was a long-term partnership and encouraging kids. We have 155 kids, and many of them have turned out to be fantastic young men. And my hope for Africa is in the young people. With education and basic health, the sky's the limit. They have the ability to do a lot. I mean, all the projects we support in Uganda are initiated by the boys. One project they keep asking me for the last many years was to get them a big cow, a cow that could give them milk. But they just couldn't get the cow because it cost about $1,000, and you had to build a special house for it. I think you saw some of the pictures going, so that was a special cow. So Keith and Linda were moving blocks and trying to build this cow. They now have a cow, which will give them between 10 and 15 liters of milk, which they'll drink some of it. The kids are very slim. They could certainly use some milk, and they could sell some of it. Because to run our project, we need $38,000 a year, and sometimes we don't get that. But if there's projects on the ground that could give them some money, I think it's better. You guys supported the chicken project. They're starting the chicken project again. So when we go in April, those chickens should be ready for us to eat. The Canadian team that wasn't ready. That is a reality. We eat the chickens.
The rooster that woke us up became
Yeah.
lunch before we left.
Yeah. So that's really it. The Boys and Girls Club in Uganda. It's just something we've been working. We started off with just a few kids. Now we've got 155. I named it after my mother, who was a big supporter of CASHA, who passed away in 2012. And that's why I couldn't go. And my friends at CASHA, I was going to end it, but to my shock, they went. I think that was the largest team that went to Uganda to continue on. So it's called the Agnes Boys and Girls Club, and it is a project of CASHA. And Agnes, if she was here, she'd be looking after you. And she truly taught me how to give back to our country. And we're not, we had our own issues trying to develop ourselves in Ottawa, but she always said, each one of us has an obligation of the country. And this CASHA project, it's really any one of us can do something. Any of you can go to Africa. I think it changes people, gives you a different perspective on life. You come back, I just came back last week, and I'm just thankful for what we have here. And I used to complain about paying taxes only when I ended up using the healthcare system when I came back. And the service I got here and the service that the clinic has, I mean, during our recent mission, Dr. Peter, when he lost a 5-year-old boy, he wanted to wash his hands. Well, the sink had no water and it was filthy. And so that just added on to frustration. But imagine a hospital without a sink and water. So that is reality. Now, this work is supposed to be fun, and it is fun. We end up having a lot of good times and laughter in the village. One of the things we do at the Boys and Girls Club is use sports to bring kids to us. But with sports, especially basketball, there's rules. No violence. The girls must play. And the girls did not play sports years ago. And now they have the court, and nobody really abuses them. I mean, you can set rules at the Boys and Girls Club that allows them to follow it. So that is the hope. I have many things I could say. I'm drifting away, but I like questions, and I think that's the basis of it. But with Kasha, with the Boys and Girls Club, we need help from everywhere we do. We always have fundraisers. We're having a concert next week on the 17th at your party. So you guys have a Christmas party, you won't be coming, but and then we're gonna have small barbecues. I always bring back stuff, drums, and that's how we raise the money. And Kasha's also overwhelmed with the overseas projects in Tanzania and Benin and children living with HIV. The Snowy Owl Foundation does a very amazing job as far as supporting those children. I think her contributions are every year, and I thank you for that. I'm very happy to be presenting with my friend who's here. We have a similar passion for HIV, and we all victim of it one way or the other. Linda, I'm biased for Uganda and Kasha and Tanzania, and my first mission was in Tanzania as well, and I didn't know what the medical mission does, but as soon as I went to it, I asked Dr. Don Kilby, why can't we do this in Uganda? He's like, no, Uganda is not badly off like other countries. And it is not badly off. I mean, the Pope just went there. It is not like South Sudan and other parts of Gabon and Benin and Tanzania, but I had to present to him that the village I live, there was people dying at the age of 47, and that is reality. The life expectancy in Uganda is still 53 and 47, and it's almost accurate. Almost all of Africa is quite different, but they face the same issues with basic health and education. And so, again, I'm supposed to speak. So Linda would just tell you what she did, find out what we worked on, and I thank her and Keith for being good team players. We're a team of 9 or 7.
Fluctuating.
Yeah, it went up and down. I'm also in the business. Anybody that wants to come to Uganda, I never stop them. If they can find their way there, I will find something for them to do. And I think it empowers kids to just have an outsider come in. It means they're not forgotten, and that's very important. So we used to need to do this, that, and we have a structure, but sometimes Africa reminds you that things may happen today, but look what happened to us. We had no power for 10 days. I did not expect that. People couldn't charge some of their phones, and some people got frustrated, but that was completely beyond anybody's control. And then when it rains, people just stay inside. People don't want to get sick. So if it rains and you get caught in the rain in Ottawa, you can go home and change your clothes. But what if you have one pair of pants, right? So things like that happen along the way. And then when there's a death in the village, the community that I'm talking about, it's a huge thing. Everybody goes to that one family when there's a death, and so everything stops. I went with now my baby's 2, and she was 8 months. We went with my wife, and somebody took her to the village, and we did not know what she was. Now, my wife is American. She's from Uganda, but that was the first time she did not know where the baby was. And she was losing her mind. Where's the baby? But I didn't know where the baby was, but I knew the baby was very safe. Somewhere in the village. And of course, the baby turned back up in a half hour, and we're happily ever after, and she still tried to find out where the baby was. We were just passing hands. And her rule was everybody must wash their hands before they touch the baby. It didn't work out. It's like, that's Uncle Jimmy's baby, and the lady with the dirtiest hands you've ever seen. Come here, my baby. Anyways, the baby's very healthy now.
That's why.
She's in Orleans. Okay, go ahead, Linda.
I'll just take a couple of minutes because hopefully we'll have more time to talk about the mission and what we did. But as you know, Jimmy came and talked last year, and I thought I was very impressed with the grassroots approach that Kasha took. So Keith and I went for 5 weeks, mainly because we did a vacation on the front end of it. And so I said to Jimmy, we've got this 3-week period in between the missions. Can we kind of hang around the center? He said, sure. So we went and we, as Keith said, he was there to be a dad. I have never seen Keith so happy in 33 years of marriage, except for the day he married me.
Oh.
But he had an amazing time with the kids. They just loved him. We had a great time working with the kids. And I think a couple of the highlights for me, Jimmy mentioned the project. So the pictures have been cycling. There's a half-built cow shed, which now has a cow. The chicks are a project that the Rotary Club of Stittsville and also Paul J., who owns the Gaia Coffee in Stittsville, contribute towards. And this is the third time now they bought the chicks. First time they bought them, most of them died. Second time they survived. This time they lost 4 because of the power shortage. The chicks are really stupid and they need to be kept warm, and so there was no power. We couldn't have the lights on because people were charging their phones. So there were braziers in there. And what do little chicks do? They go and they stick their nice little bums up against the brazier and they burn themselves. Anyway, so they lost 4, but that's not bad given the conditions. Other projects they have, they tried raising pigs, but that's difficult. But they have a flower growing project, so chrysanthemums, and they grow these mums and they take them to Kampala to sell them. Nobody else is selling them, so they make a lot of money, and it helps pay for the electricity in the center, buy food. There are about 8 kids that live at the center because either they don't have good conditions at home or they don't have somewhere at home, and they all contribute. So these kids, when we were there, this one young man was up at 5 o'clock every morning because his chore was to clean the bathrooms before he went to school. And that's what he did. And then he went off to school for the day. And he would come back, and I've never seen anybody with work ethic like this kid. So, well, our bathrooms actually weren't bad. It's what we thought was luxury. It was,
fixed them up a little bit.
yeah.
You need some Canadian standards. But
You
first year,
can sit down.
first year you can sit down. You have to go and.
yes. So there's a traditional bathroom, which is kind of the squat bathroom, and then there are 2 or 3 regular toilets, and the shower that has warm water, and then the guest house up the hill. So I'll talk more about it later on, but it was such a great experience for us that he's going back for the medical mission in April.
Oh, really?
Yeah.
I have to talk to you about how it
But, so he's a pretty special. We drank the Kool-Aid and we just really, really love the place. And there's some pretty special things that have been done there with these kids.
Keith, you want something to say?
Okay. I'm not going to use that because I'll blow your ears. We talked about the volunteers. We talked about Kasha and work
Could you
on it.
please use it? We're competing
Okay.
up here.
Yes.
Okay.
Thank you.
Just hold it down.
Okay. The kids that are being supported going through school, they're getting their school fees paid, but the families do have to do the rest of it. So the uniforms, exam booklets, papers, etc. These kids are working hard. And I just want to bring up one kid, and he's no longer a kid. He's a teacher who got himself into the program, got himself supported, is now teaching at one of the local schools. And the young man that Linda was talking about, we decided that we are going to sponsor him directly as well as providing a donation to Kasha for general purposes. And we asked this teacher, can we hire you for a couple of months to take this 18-year-old who's in the equivalent of grade 9 now because he didn't start school until much later, get his English up so that when he goes into the better school, he can do it. And Peter said, perfectly willing to do it, but you can't hire me to do it because he's giving back to the project. So that's the type of young kid that's turning into the young men and young women that's coming out of this project. So that's the end result. It's the kids are going along, they have very little, they're almost nothing, they're smiling all the time. I'm not sure whether or not they were smiling with us or at us in some cases. Jimmy may have his own opinion on whether or not they were laughing at us. It doesn't matter, they were smiling. They were obedient, they came back to Cubs here and going, God, these Canadian kids. But it carries on. The center director is another one of the graduates of this program. So these kids are staying, and they are bringing back their own work ethic, showing an example for the next country, or not the next country, the next generation that's following along. And that's what I really like, because I'm a cynic on a lot of these things, but I did enjoy it as Linda said, even without the structure training.
Thank you very much. Do you guys have any questions for us? Do you want to add on to that? Did I answer all your questions? I hope you know the difference between Kasha and the Agnes of Rotary Girls Club, but really they're the same to me. They both need help, but we're all very happy. The kids that you guys are talking about, the kids don't have much, but they're very happy, and they're very thankful and grateful. And Peter, that you mentioned, his salary is actually very little. And in addition to teaching Dale, he gives a month, one of his salary he donates back to the project. For an African teacher to donate a monthly salary, which is I think $120 equivalent, he's giving it back, and so it shows you that I guess the project is taught them they will have an obligation to just give back the little they can. They don't have to, and this whole project everybody's free to do as they wish, but they keep staying at the center, and every one of them is picking up a young person that they're trying to teach to be responsible.
Do you have any questions for us?
I'm sure that's good.
You want to know where to send the money? We want to thank you for your donation to start with, but we also want to thank you for your time and giving us the opportunity to come here and let you know what CASHA is all about. And if you have any questions, please don't hesitate to give us a call. Linda knows how to reach us. And thank you. Thank you very much for having us here. Appreciate it.
Thank you. Now I ask Mo to formally thank you.
Ladies and gentlemen, that was really inspiring. What you're doing over there, what the results are showing over there. It's very admirable. I really appreciate hearing how the program is growing and developing and what has happened in those 15 years. It's great. As you've seen before, we don't make any direct donation or for your presentation, but we do present about the library on your behalf, so we'll ask you to sign that. And we'll be
Immortalized.
immortalized. That's the word. Thank you, Sue. I lost the words tonight. So.